Dr. Justin Knott, founder of Physical Therapy. I'm lucky enough to be here and joined today with Keelan Enseki. He's a good friend of mine that I've known for over 10 years now since I first started my career getting into physical therapy. This man's been involved in research, teaching, and being an advocate for the profession. He's been involved with the American Physical Therapy Association. So, welcome, Keelan. I'm glad to have you with us today.
Thanks for having me.
Yeah, so can you do me a favor, give a little insight about who you are, what your career has kind of brought you to this point, and what you've done?
Yeah, so obviously, I'm a physical therapist. I'm also a certified athletic trainer. I've been doing this now. I'm going to date myself here about 20. Been a PT about 23 years, I believe. I went to the University of Pittsburgh, stuck around in the Pittsburgh area, been there ever since, and have had many different roles in the organization as a staff therapist. And I went through a residency program, and now I direct a residency program, and actually have administrative oversight over. We have 5 residency programs. Done some writing, some research, still treat patients. I primarily see patients with hip disorders a few days a week. And then, then have remained involved at the academic level with the university, teaching some of the musculoskeletal content related to hip injuries. Then our national organizations, the APTA and some of the academies, particularly the orthopedic and sports academies.
So you've been busy over the years, is what it sounds like. Tell me a little bit about you. So passionate about the profession and what you do to kind of advance it. Can you tell me a little bit about what motivates you to be so involved in over so many of these years?
Yeah. There's a number of reasons I've stayed involved over the years, and some of those roles have kind of evolved over time. Part of it is just because it's part of my professional responsibilities, literally with my job title, which has a bit of an innovation role built within it. So I have to stay on top of what's happening, current concepts, what is happening in the field, particularly in orthopedic and sports, but really just in general. It's just staying involved with best practices is what's best for our patients. So kind of knowing what's happening. It's an ever evolving field. What is not just in today, but what is best practice today may not be best practice tomorrow. And some things go full circle, but obviously because I want to, and I know it's what's best for my patients, best for my professional development, and it's part of my job.
And I know that I can't think of a better person to try to explain what we do as physical therapists. For I know I get patients that come in that I've never seen a physical therapist before, don't know what to expect. So I just think it's enlightening to kind of explain to them who we are, what we do, what we have to offer. So can you give a little bit of your input on giving a patient a little better understanding of what we do as physical therapists and what we have to offer?
Yeah, it's interesting, right? Because it's amazing how many people, like friends and family members, don't really know what we do. I think they have an idea of what we do, and usually what their preconceived notions of what we do are false, or just only part of what we, our whole scope of practice. I think a lot of people think of what we do as the prescriptive component, particularly exercises, maybe manual therapy, maybe modalities, something of that nature, and that's all they think of. What we're doing. I think what's probably underappreciated is the valuative component. What we do in terms of what we see with our eyes and hear with our ears, and how we synthesize that information, and how we can not only use that to dictate what we do from a treatment perspective, the things I think many people are familiar with, but also where we fit in the broader healthcare system, our role, in delivery, and what we have to offer. And I think a lot of people just don't. It's not their fault. They don't understand that. Maybe it's somewhat our fault, or maybe it's just the way things are within the way medicine is looked at today, or healthcare in general. But I think and I do think people are coming around to appreciate our broad scope of offerings, if you will, within the greater healthcare system, and really to the community in general.
I know that I was kind of fortunate growing up. My mom's a physical therapist. So when I was little, I knew what physical therapist was. And me and her, as I gotten older and I've kind of joined her into the field, have had so many discussions over what it's been like for her when she came out as PT, and then what it's like for me, and how it's evolved from a bachelor's to a master's. Now we're doctors of physical therapy. And with that component comes more education, more expectations, more abilities and skills too. So just as someone that's been in the field for so long and I've seen so many different areas of it, can you tell me a little bit about your experience and your input on what physical therapy has kind of evolved to, where it started, where it is, and where it's going?
Sure. And I think the changes we've seen in the profession, and this is good or bad, depending on how you look at it, the changes, not everyone sees some of these things the same way. I think that they've occurred for a number of different reasons. One's the education component, right? When you went through school is way different than when I went to school, which is way different probably than when your mother went through school, in terms of the how robust the information is. And that's the reason we're in there longer these days, or the students are. So it's partially because of that. Part of it is evolving with everything else that happens in healthcare in general, and then our field in general, technology, et cetera. So I think what I've noticed, over time is this expanded role of what we do, and I think what we deliver, to the populations in terms of healthcare, are evaluative skills. We don't just measure not that they're always, it's always important to measure impairments. We think of range of motion, flexibility, strength, etc., endurance, depending on, what your particular facet is that you work within. But there's also the biopsychosocial components that we are now much better trained to account for. So we look at not that we never, I think as physical therapists, we're one of the better professions looking at the whole person, but now that is formally taught to us so that we can more effectively deliver we can use a more complete skill set in the way that we manage patients. And therefore we have more to offer.
I definitely think that something that stands out too is we had a phone call the other weekend. We started talking about just the day and age, especially since the pandemic and all this change with the digital era. How are we as a healthcare profession, especially one that is very hands on? And I feel like a lot of our skills and a lot of benefit comes from us being in person, can walk someone through someone, teach someone, get our hands on someone. But in the day and age where things are moving a little bit more virtual, where you have more access to things, what do you think are some of the disadvantages or advantages in the shift of the profession during the virtual era?
Yeah, that's interesting. It's debated, right? And I think you could find people who will both embrace and I don't want to say deny it, but really speak out against it, so to speak. And then there's a lot in between. And again, part of my job is tied into digital health, so to speak. But I think the way that I look at it, when used appropriately, it's a way for us to extend our skills into spaces and places where maybe they wouldn't be before. It's a way for us to have our eyes and ears when perhaps they can't be in front of us. So I think, the naysayers, so to speak, may look at it as replacement. And I think there are definitely efforts, and you can find efforts of people trying to literally replace us, and that, I'm against that, myself. On the other hand, to look at it as an extension of our arm into the patient's home or environment where we may not have been able to reach them before. And the technology is there. It has been for some time, and it's only getting better. It's only getting more scalable. Other facets of healthcare are doing this. Other people will do it if we don't, and deliver a lower quality product. So I think when we take the digital component and we blend it with our skills and use it to enhance our delivery skills or deliver it to more people and more efficiently, maybe more affordably, and scale it in that manner, that's where it's really most effective. But I mean, and I do understand the concerns that come along with that as well. But when we responsibly use digital means to deliver our healthcare and enhance access, which is a big problem across the board, not just physical therapy, I think it does have a lot to offer. And you're always going to have debates as to how that should be employed and what's responsible use of that particular medium of delivering our care, particularly us, hands-on, probably the most hands-on profession out there you can think of. Maybe, I think that debate will be there, but I do think there's a role for it. And I think it's something that to some degree we're going to have to embrace, adapt, and use, because if we don't, someone else will do it, and they'll do it in a much lower quality, less optimized fashion.
I couldn't agree with you more. And one thing that always stood out to me is I'm getting more and more patients that come in that they do have the access to the internet and Google, and they're able to look up all this information out there. Some of it's good, some of it's great stuff, and I'm glad that they're able to access it. But I do look at it as us being able to kind of be an educator or guidance in that too, because I've had people that come in, they're like, "Hey, I looked it up, and I saw this PT online doing these exercises, and I've only been feeling worse." And it's not always the greatest information, maybe not the most appropriate or patient specific for it. So I can see the pros and cons to this as we go. But what do you think? Like, what role can PTs have in today's digital era to have the most impact on recovery timeline for patients?
Yeah, and digital tools are always, digital information is always an interesting, it's out there, right? We know that. And to just tell someone not to look at that is obviously not an effective means of everyone looks at, they're always on their phones, whatever it may be. So I think one thing we can do is we can assist our patients, right? If we know they're looking at these things, we can either one, direct them to trusted sources, of which there are a number. And I'm always honest with my patients, feel free to look at whatever you want, just ask me, and I'll tell you if it seems to be a trusted source or makes sense. And if not, obviously, I would hopefully I would honestly tell you that as well in an unbiased fashion. So we be a little bit of a gatekeeper. We know they're going to get that information, to the extent, we don't have 24 hours a day to review everyone's information, but at least we can help kind of guide them that way. Because again, we know they're going to be exposed to it. And then if we have the opportunity to play a role, which is what you're doing here, in disseminating that information, doing so responsibly so that we keep whatever information they're getting to the best of our ability, particularly if we're the ones delivering it, at the same quality we would if they were right in front of us, and the same expectation.
One thing that's always stood out to me is now when I was in the clinic or when I am in the clinic, it almost seems monotonous at times. And I'm always seeing the 2 to 3 times a week for 4 to 6 weeks. or whether it's an ankle sprain all the way up to like an ACL reconstruction at times, blows my mind because I know that we're going to have bigger impact down the line and can be utilized as we go. And I think that sometimes that deters some patients where they don't want to work it in that time as the schedule doesn't work with what they're doing. I'm kind of shifting over that idea of, well, we kind of match what the patient's needs are to be there as we go. What is your opinion about how PTs can be utilized in the recovery process for people with guiding them through the era of virtual care to give them more independence and more tools, resources? And where do you think PTs fit in that role of it, where we don't necessarily just see them for a brief period of time, but we're kind of there as mentors and guides through their process and recovery and even beyond that?
Yeah, I think another way to look at it is well, one, the days of, and I practice in those days of 2 to 3 times a week for 4 to 6 weeks or more are probably not coming back in many cases, and maybe shouldn't have been, for everybody anyway. There are definitely cases where it was justified, but and for numerous reasons, one being resources, regulation, payers are not apt to doing that, for everybody. So we know out of necessity, even if someone's paying for themselves, they may not want to do it if they and they will figure it out if that's not the best use of their resources. So we can use our clinical judgment enhanced by digital, what is available, let's just say technology, to optimize usage. And then it's responsible utilization. You want to do it in a way that optimizes outcomes, so we have the correct touch points, if you will, when we engage somebody. And maybe that's the hybrid approach, I think, is the best way to describe it, where yes, in person, there are some skills that can only be done in person: manual therapy, certain evaluative skills, assessment, etc. Even with all the technology that's out there, utilizing those sessions responsibly when it makes sense. When someone is doing exceptionally well, you need to get them in the clinic, you need to progress them, and that can only be done in the clinic. They're not doing well or they're regressing, you better get them in there, and determine whether they should be in therapy, they need referred. But there are also times when just having the ability to touch base digitally, whatever model you may choose, is also very helpful. One, because the patient might not have been able to make it in any sooner. You may be able to progress them at a point where you wouldn't have seen them for a few weeks, save time, save resources, again, responsible utilization. Or there are cases where referring them to someone else in the medical system because they're no longer appropriate for therapy. And maybe you're avoiding something, if not catastrophic, that would have negatively impacted their outcome, their rehabilitation episode, and slowed them down regardless. So I think taking this hybrid approach is often an optimal approach when done responsibly from all perspectives. I think everyone can benefit from this when you see each other's perspectives. And again, I think it's responsible utilization as opposed to an absolute yes or no.
Yeah, I couldn't agree more with you on that. And I do feel too at times that I'm seeing patients that if I could only have gotten my hands on them sooner is something I've kind of come to feel of. Even with our healthcare system of having to wait a while to get into the doctor who might just be writing a referral, and by the time you get into the clinic with us, man, if we have only seen you right after the injury, we could have more of an impact. We could have been more preventative, not having any of these compensatory injuries or secondary injuries that I've seen in my career so far, with guiding people to get good resources and kind of shedding light on what's good or bad. Do you got anything that stick out in mind when you're talking to people of, hey, these are some people that I follow, or some information I stay on top of, or any kind of resources that you think that would be valuable for people to know?
I have a default answer to that I always, for patients. There are many good resources out there. So I never want to close the valve and shut off everything and say, hey, only go to these certain resources. So I used to have a kind of I guess you could say it's a canned answer in a way, but I think it's an appropriate one, where I tell them I know resources that you can go to that are reliably valid, good, almost all the time. And those would be our professional organizations, which have now, some of that content for us may be, if you're not a member, you can't access it. But often there's another side of that where they have patient resources that they can access that is open to them. The APTA, the various academies, depending on your interest, your domain that you practice in. There's other somewhat related professional resources. I feel pretty confident in saying, yeah, you can go to them and the information you'll get is valid. Now, how they apply and such, that's often where we may play a role there. But at least I feel they're not getting something completely out of sync with what's, best practice and evidence. And I also tell them, as I mentioned before, that doesn't mean there aren't other good resources out there. There's some good independent resources, independent practitioners, clinics, other people who are just experts that put a lot of content out. It may be out there, and I'm happy to if they just send them away and say, hey, I know that makes sense, what they're saying, or it's not completely nonsense. Or I could teach, maybe one other thing I'll mention to them is look for red flags. I don't mean medical red flags. I mean red flags like, is it touting a certain product that they're associated with without disclosure of that? Repetitive promises and things that just if it seems too good to be true, it probably often is, particularly if it's offered in the digital format. So at least give them a little bit of, kind of key components of what they should look for, and then tell them, if they ever have a question about it, just talk to me, and I'll at least try to give them the best kind of insight as to whether that's a trusted resource.
I feel the same way. I feel like that's very similar to when someone comes into me like, "What is that one exercise though that I need to be doing that covers everything?" And
Yeah.
it's always like, "Well, what are we looking for? What are our goals? What kind of specific things are we working on?" So I'm kind of right there with you. I'm like, that's a hard one for me to answer because it really depends on what you're looking for, what your capabilities, your history is, your understanding of things, what you're trying to get out of it. So I'm kind of right there with you. It's bring it to me and let's have a conversation about it because everything's fluid. It all depends on what you're looking for, what you're trying to get out of it. So I'm right there with you that I'm constantly trying to find new things. Like, hey, I like this here, but you can find it in multiple different areas. But how does that apply to you? And that's always something I'm like,
Yeah.
you shouldn't specific. I want to figure out what's right for you. What one answer might not be the same for the same two people with the same injury. So, what are some recommendations from you on where to look and how to stay involved in the profession to help promote the advocacy for physical therapists in the field? So we talked a little bit about what information for patients, but I think just as important now that I've been out in the career and doing this for, I don't want to date myself either now, but to be able to talk about the different therapists I've seen that have either been getting burnt out, so just don't seem as motivated, whether it's productivity standards or seeing three or four people at the same time. And I've had that discussion. I think it's very useful to have people in the clinic that are ambitious and love to do what they're doing and staying on top of the latest research. But I can understand the difficulties as another clinician or a physical therapist where you don't have the time or the energy to continue to stay up on that. So not from the patient standpoint, but from the physical therapist standpoint. We talked a little bit about the APTA, but beyond that, is there anything that you would kind of encourage or ways that you've seen to be useful, especially as a mentor and teaching people through the residencies, that you think would be helpful for other physical therapists to know or to be looking into?
Yeah, it's a good point because healthcare in general, right? It can be pretty easy to burn out. You give a lot, and sometimes you feel like you're not getting, much back depending on the day. In terms of, and I don't mean financially. I mean, just the grind, right? The grind of being a clinician, and admittedly, I'm not in the clinic as much as I used to be. But I think, well, one, I've always been forced to kind of stay on top of things because I work in an academic environment. So the people, some of my mentors are still around, right? So I know what they're doing, and you always kind of you always hold yourself to a higher standard. But that being said, that can happen in any clinical environment. It could happen in a two-person clinic, right? Or if you're the only person and you just have other colleagues in other clinics, to have somebody you look at as a mentor and keep in contact with them. That can be clinical, right? Your clinical skills. That can be your professional development. That can be topics like we were talking about handling. How do they handle their schedule and balance it out with family life, which is always, it's a big challenge. So I think always having somebody that you can look up to or look to as a colleague and keeping them close by, if not physically, at least, now that we are so connected, within a conversation is very important. And then, consistently at certain time frames, reevaluating your goals, and kind of knowing where you want to go. And then determining if where you're at is matching those goals. It may not be everything you want because that's very rare, but are you at least getting the majority or many of the things that you want? And do you see your path still moving forward to where you want to be if you're not there yet? So I think constant reevaluation, like we talk about with our patients, of your own kind of professional goals, where you're at, and are you on the path there, or are you just kind of stagnant? And the answer may not be an answer you like, and then how do you handle that? So it's kind of using your valuative skills and your skills, your problem solving skills, and your own, like I said, you dedicate all that to your patients, but maybe dedicate it to yourself at times.
I think that's some great advice there. That's definitely something that, hey, for me, it's like a 5 year plan. It's so, well, what do I want to accomplish? Is there things I'm moving towards? And kind of have that reassessment, just like patience. It doesn't always go the way you plan. So maybe taking a step back and figure out a different approach that might work better for you, but always find that motivation because, yeah, knowledge is power. So the more we know and finding out what weaknesses we might have as clinicians, I think is always a positive thing because it gives us something to identify and work towards.
Yeah, sometimes you change what you wanted out of it and your goals and such. You should probably, if you have to change your path, do so. Nothing worse than being miserable in your job, right? So you want to be enjoying what you do, because I don't think I'm going on a limb to say we all work hard in our clinical buyer. It's clinical care is tough. It's ever changing. It's not getting any easier. So you want to be happy most of the time while you're doing it.
I'll tell you, you're probably the one clinician that I can think back of that I can't remember one day working with you where you didn't walk in or have a smile on at some point in the day, regardless of what's coming in that door, because you obviously love what you do. I love what I do, so I'm hoping to see the profession grow in the future too. So I guess what are your hopes to finish off and kind of wrap things up with it too? What are your hopes to see as the profession grows in this ever-changing, evolving world and competition, whether it's with other professions to be there and just be that advocates that we can be for our patients? What are your hopes and dreams for the future for us?
Yeah, I hope that we continue to grow in terms of the recognition of our place in the healthcare system, where I think we all know it because we're working so hard and we went through a lot of training to do this, but that our peers and colleagues and patients, ultimately probably the most important, right, recognize what we have to offer, and then on top of that, that we get a chance to practice across the board, across different settings at the top of our licenses, and what we can do and use our skills, and then we also get, I do want to see professionally that get reimbursed for it, because you want your clinicians to be happy. So those goals I think are all tied together, but I want to obviously see that continue to advance. I recognize the challenges with it. We're not the only ones, right? It's many people in healthcare professions in general, but I do want to see us kind of answer that challenge and hopefully kind of united movement forward and continue that progress that a lot of people well before me have worked hard to try to establish.
That's awesome. You got some big shoes to follow, and you continue moving forward. So I hope the career and profession has so many people just like you as it grows, because you've had such an impact on me, whether it was learning, you mentoring, seeing you lecture, seeing you treat. There's one thing about learning something didactically, but a whole different thing to get the experience, or almost like apprenticeship to see and learn. When I was out in Pittsburgh, I got to learn from so many great clinicians. I think I took it for granted when I was there that you get out in the real world and but hey, that was a pretty good time there. That was a lot that you learned, and you're around people that were really passionate and wanted to see things progress and didn't want to just follow the status quo. So really appreciate all that you've done, whether it's the research, your advocacy for the profession, and really, really appreciate that you took the time today just to sit down and have this chat. I think it's been a benefit for me and hopefully for our viewers. So
Yeah, it's my pleasure. Happy to be here and happy to see what you're doing, and really happy to see people who have been kind of cross paths in our clinics at various times go out and do things all over the place, all over the country, really all over the world. So keep doing what you're doing, because that's what we need.